I'm originally from Mercer, Georgia, south of here. Grew up there, finished high school there, and also went to college there at Georgia Southwestern. And growing up, I have an uncle who was an orthopedic surgeon in Birmingham, and that really got me looking into the field initially. He was gracious enough to let me shadow him some, and he would talk to me about orthopedics every time I was around him. So that was kind of my first introduction into the field. And then as I went through college, I knew I wanted to go into medicine, as a career. Wasn't sure that orthopedics was going to be what I ended up doing, but stayed there, went to college, applied to medical school and got in, and finished that 4 years in Augusta at the Medical College of Georgia, and decided that I wanted to do something surgical. So I got into what's called a transitional internship, which basically means what it says. It's a transition, between medical school and residency. Decided after that I wanted to do orthopedics. But in order to do that, the programs were full at that time, so I ended up doing 2 years of general surgery and then did 4 years of orthopedics. So I basically did 7 years of residency. Well, basically I think of it as both surgical and non-surgical treatment for bone and joint complaints and disorders. There are certain things that you're comfortable treating or that I'm comfortable treating in any joint area or area of the body. And once something appears to be outside of that comfort zone, then yes, I would refer that to someone who specializes in that particular area. Basically, care needs to be patient-oriented. So everybody's different, every patient's different. Their approach to pain is different. And that's just something you have to understand when you get into this field, is you got to be flexible, and you got to be open-minded and listen to the patients. And they need to be the center of the activity. And then my approach is to be open to what the patient has to say and what their problem is, and then try to attack that from the things I've learned. I would strongly disagree with that for the vast majority of the things that we treat. Most of us here at OrthoGeorgia trained at very reputable programs, which is the same places that people in Atlanta and other places trained. So it's not like we trained any differently. Matter of fact, we trained some of those people ourselves. So that grass is always greener on the other side. It should not apply to what we do orthopedically, I don't think. Well, if you look across the country at different orthopedic training programs, you'll have different philosophies in terms of treatment concerning the same issue. And we're fortunate enough to have physicians that trained in different places that bring those philosophies in, and I think it leads to better patient care. Just different ways to look at the same problems. And orthopedics is very dynamic. It's changing all the time. The way we treated certain problems when I trained are completely different now. Back issues, for instance. I treat them completely different today than I did, 25 years ago, in a lot of cases. And that's true for several different areas of orthopedics, I think. I'm married, have 4 kids, and have have been very active in their lives if they have grown up. I've got one out of college, 2 in college, and 1 still in high school. So a lot of my interest outside of orthopedics has been in their lives with what they're doing academically and athletically. I live up in Monroe County on 25 acres, so I get a lot of free time, you know, to kind of get away from things when I need to there. One reason I moved out of the city was so I could have a property with land and a 3-acre pond on it, so I can kind of get away and do those things, fishing and hunting, be with my family, play with my kids and things. One of the, I think, strengths of our practice is that our physicians live, work, go to church, and in our community, in Macon. And they're dedicated to the well-being of this community. We practice here. We work at both Coliseum Northside Hospital and the Medical Center. And we try to cover all aspects of orthopedics so that we can take care of patients locally and do not have to refer them to outside facilities and outside places. And the recent opening of our new spine center is a testament to that, I think. We're able to offer services there now that we feel very, very good about, and we think our patients will too. And so far, we've only been open a couple weeks, but it's been very well received, I think, by the patients. Another strength of ours, and certainly one of our OrthoGeorgia goals, is to work hand in hand with the primary care physicians. Communication, I think, is a key to taking care of patients. And the communication between their other physicians, especially their primary care physician, is extremely important. And I think it's becoming more and more important as we move along, as healthcare is changing, insurance is changing. Patients seem to be more confused than they were even 5 years ago. So that's one thing, one emphasis I think that we're starting to really pay attention to now is communication, especially with primary care doctors.